Good morning and welcome to the Insight APSAD webinar series. I would like to begin by acknowledging the traditional owners and custodians on the land of which this event takes place. I'm coming to you today from Meanjin on the lands of the Turrbal and Yagara people. I would also like to extend that acknowledgement to any Aboriginal and Torres Strait Islanders who are joining us today from across the web. My name is Sam Clark and I'm one of the nurse educators here at Insight, and I have the pleasure of facilitating today's webinar. Our presenter today is Dragos Ileana. Dragos is the statewide transcultural mental health practice leader at the Queensland Transcultural Mental Health Centre. Dragos previously worked as a coordinator of the Transcultural Clinical Services. Dragos is a clinical psychologist with expertise in working cross-culturally in the mental health, counselling and psychotherapy areas. He is also an APRA clinically endorsed psychology supervisor and has been involved in delivering training in culturally sensitive practice to clinical psychology masters and PhD students from different Brisbane-based universities. Dragos has been involved in conducting clinical research with culturally and linguistically diverse consumers, exploring the importance of using clients' cultural frameworks and engaging bicultural workers in conducting assessments and providing treatments. In his current role, Dragos works collaboratively with statewide stakeholders towards supporting mental health and alcohol and other drug systems to become more culturally inclusive and responsive. So in today's presentation, Dragos is going to talk about the Transcultural Mental Health Practice Framework, which is an overarching framework which aims to clearly articulate what best practice in transcultural mental health consists of and how it can be translated into practice in the Australian context, whilst also strengthening the capability of the public mental health workforce to achieve strategic directions and recommended actions, whilst supporting the mental health and alcohol and other drug services to meet accreditation standards as defined by the National Safety and Quality Healthcare Standards. The development of mental health and drugs and alcohol services that are accessible and responsive to the needs of people from culturally diverse backgrounds is not a distraction from the core business of mental health services, but rather a means through which services can be enhanced for the benefits of all service users. A person's cultural identity affects their subjective experience, expression, and understanding of mental illness and their expectations about diagnosis, treatment, and ongoing care. People from a cold background experience specific factors which increase their risk of mental health issues, whilst facing additional barriers to accessing care. This presentation will focus on an overview of the Transcultural Mental Health Practice Framework, along with tips on how it can be implemented in practice. So without further ado, I will hand you over to Dragos, who will be delivering this session this morning. Welcome, Dragos.
Thank you very much. Good morning, everyone. Thank you, Sam, for this comprehensive introduction. Pretty much you did all the presentation, so I can go home now. So yeah, just a little bit of joke here at the beginning, but I'd like to obviously thank Insight for the opportunity that give to us to share the work that we do in Queensland Transcultural Mental Health Centre. And I'd like also to say thank you for the audience for your interest in transcultural mental practice. Now, first and foremost, I'd like to start by acknowledging the traditional custodians of the lands we are all coming to this meeting today. We pay our respect to elders past, present, and emerging, and acknowledge their spiritual connection to the country. We give our gratitude for sharing this land with all of us. I personally give gratitude for living, learning, creating, growing, as well as thriving on this land, which belongs to the most ancient civilization in the human history. Staying with the acknowledgements, I would like to also spend a few moments to acknowledge and recognize the lived and living experience of people with mental illness, problematic alcohol and other drug use, as well as those impacted by suicide and trauma, their families, carers, and support people. We respect their values, their opinion and contributions towards the recovery and input into service delivery and in the systems transformation. Now, I'd like also to use this opportunity because we never had this chance. Usually I don't go to that deep, but I think this is such a special event. I thought that I would spend a few moments to reflect and to also acknowledge some of the contributions. And I'm going to refer first to an African proverb from Ubuntu culture, which says that if we stand tall today, it is because we sit on the shoulders of our ancestors. So similarly, I would like to acknowledge the contribution that over the 26 plus years of Transcultural Mental Health Center, everyone that worked in that field, there are many hundreds of people towards contributing to the knowledge and expertise of our center. I also like to thank and acknowledge those that have contributed and are still contributing to this project around transcultural mental health practice framework. Going a little bit further, I would like to spend a bit of time to really reflect on the meaning of what transcultural really is. As you can see on the right-hand side, we see here the importance, the significant role that we play in our space, because it's so much about, we are so privileged to work across cultures, because every single culture tells a story of a person, but also a story of the people that come from a different part of the world. So for us, it's very unique. We are in a very unique opportunity to really learn about what culture brings and how culture defines and shapes our identity and the way we look into the world and the way we give meaning to life. So at Transcultural Mental Health, we had this opportunity to really understand this intersectionality between cultures. I think it's very important to also say that the name transcultural comes obviously from the transcending culture, which means it's not that we skip culture, but we emerge. So in other words, it's about understanding that beyond the symptoms, the mental symptoms that someone presents with, there is a story, and in that story, that journey, from that journey emerges the identity of our client, but also in their stories relies the key of the treatment of our patients. That is why we insist so much in understanding, and we use terminology such as culturally informed care formulation. So it's so much about understanding culture and understanding a person from within. So this endeavor that our system has to be client-centered approach, and to really come with an individualized plan around recovery. Also, we're trying to understand and not to pathologize a certain presentation that conflicts with our way of seeing things or perceiving reality or give meaning to life. So today I thought that I'm going to spend and to use this opportunity to first talk about a little bit of the rationale, a little bit of the landscape and the context that from which this need of creating such a framework came up with, and I think it's very, very important to look into understanding not only the complexity, but also the benefits that the system and us as practitioners would have in the situation that obviously we will really go deeper in understanding, and also in developing what we call cultural competence at the individual level and culturally inclusive and responsive practice as the system at the system level. In the second part of the presentation, we'll focus on the how this framework is going to look like, who is involved and who has been involved so far and who will be involved, as well as what this practice framework is going to look like. So as I said, a little bit of the context, and we start obviously with data, what data shows, and I think it's very important to say right from the beginning that that it is very difficult, and this is quite a challenge for us to accurately capture the cultural diversity of the Australian population. And that is because when it comes to culture, the definition of culture is way beyond the country of origin, is way beyond the language, and also you could easily be you can easily identify as a cult if your parents or even grandparents have migrated to Australia, had migrated in Australia, and obviously would impact on the way the education and the family roles were shared, as well as the system of values and belief aspects have been communicated through you most of the time unconsciously throughout your upbringing. So going back to the stats, in 2021, the census counted for more than 25 million people in Australia. I think it's very important here to say that there is an increase of 8.6% since the previous census in 2016. There were over 7.6 million migrants in living in Australia, with 29.8 of Australians' population being born overseas. Australia's population increased by quite a significant amount of people, and a significant contributor to this obviously is overseas migration. Now, I think it's very important to obviously look in some of the criteria that we use when we try to collect this data, and we often refer to the country of birth as giving us an indication around who pretty much comprises the people that migrate to Australia. As you can see, England is first place, second being second by India, China, Philippines, and here obviously is New Zealand, but due to an error, I did not make that visible. And I think it's very pertinent to say that New Zealand is probably the best example of how culture can become invisible. So obviously we all know that New Zealanders speak English, but not all New Zealanders would share the same cultural background as for instance, people coming from England. So this is where culture and understanding of the deep surface of culture comes into play. For instance, we have a significant amount of population from a Maori and Pacific Islanders background that migrated to Australia via New Zealand. And when it comes to the cultural diversity, is significant. So it is significantly important for us to really expand our understanding around how we capture data from a cultural diversity point of view. Now, it's very also important thing to a key point here to underline that over the last since 2010 to 2020. As you can see, the changes, the changes in the trends have changed in as far as India, China, Philippines, and Vietnam point of view. So that really shows to us that while there are migrants that come from England, for instance, that remain steady in terms of the number of arrivals, there are differences in terms of the way the migrant population changes over the years. And if we expand the history of Australia, we know that there have been waves. For instance, after the Second World War, we had Italians, we had Greeks, and then in the 80s, we had people from Vietnam. So it's really, transcultural mental practice really looks into understanding and incorporating and taking into consideration the trends, but also what happens internationally. So when it comes to narrowing down to Queensland, we can see that more than 1 in 5 Queenslanders were born overseas, and the number of Queenslanders born overseas grew from almost 700,000 in 2006 to more than 1 million just 10 years after. When it comes to how this is distributed in Queensland, Brisbane, Logan, and Gold Coast made the top 3. With Brisbane having 11 suburbs, where more than half of the population was born overseas. Staying with Queensland, it's also important to see that almost 2 in 5 Queenslanders were either born overseas or had at least one parent who was born overseas. And since 2005, Queensland has been marked increasing arrivals from, like I said, India, China, South Africa, Philippines, and South Korea, having the most common languages in 2006 that have been spoken at home, being Mandarin, followed by Vietnamese and Cantonese. Now, it's very interesting to see from a different point of view in terms of the dynamic of the landscape that every 1 minute and 44 seconds, one new baby is born, and every 2 minutes and 39 seconds, a new migrant comes to Australia. So Brisbane population the growth rate is very consistent, and adding 30,000 to 140,000 people each year to the overall population of Australia, with Metro South Health region being the most culturally diverse in Queensland, having over 28% of the population being born overseas, and 41% of those first language isn't English. So why this is important for us? So obviously that raises a significant question, which is investing in cultural competence and investing in developing our mental health and other drugs systems to become culture responsive, inclusive. That means that we invest in the future. Obviously, it's very, very important for us to focus on the current situation. But as you can see, the future population that we are going to serve as health practitioners is going to look slightly different than how it looked like some years ago when we were starting to become health practitioners. So being culturally competent and having this receptiveness around services becoming culturally responsive is a very important strategy that puts us ahead of the game. And obviously, as you can see later on, is going to support us in delivering better care to our consumer consultants, to our consumers, as well as having obviously more confidence as well as more work satisfaction. So I thought that I'm going to spend a little bit of time also focusing on the whys, the rationales. So why culture matters. So obviously we know that the identities of us is pretty much shaped by the culture we have been brought on, and that it manifests through various means such as food, clothes, our flags, our festivals, our rituals, our language, and culture as a whole, including literature and arts. Now, but this is only the tip of the iceberg, because the deeper we go in terms of understanding someone's culture, including our own culture, the more we understand that our identity is shaped by our set of values, by our belief system, by our even the notion of self and gender roles and the family roles we later on are going to play, as well as the sense of justice and what is relevant in the health care system is the way people would shape their own expectations and the way they communicate their needs when it comes to especially the mental health treatment. Now, the reason this is important is not only for us to really go deep and to really understand the roots of our clients' identity and their own untold story, as well as their expectations from treatment and the way they expect us to engage with. But also it's important from us understanding in that relationship, in that therapeutic relationship, what are our implicit bias, what are our blind spots, how that this could play out in the therapeutic relationship. Because if you think about it, and a lot of the research talks about that a very good outcome, therapeutic outcome, relies so much on the nature of the relationship that we have with our consumers. So it's significantly important for us to really develop this self-reflective attitude, to really have this cultural humility, to really understand and to really detach from our own way of seeing things and assuming things. And it's very, very important for us to really come with a respectful curiosity, and this is what we call creating a culturally safe space with our consumers. Now, imagine if we keep this exercise every single day, not only in our professional side of life, but also in our personal life. How this the quality of life, the quality of our personal relationship, as well as what would happen at the international level, how this could impact on our ability to understand the other person's point of view, that is so much determined from the angle that they are coming. Now, we use this exercise, experiential exercise, to really support people in the audience to understand what really happens from a psychological point of view in the process of migration and acculturation. So I'm going to invite you to reflect for a moment what defines your identity. And I'm going to really ask you to reflect on 5 characteristics that you identify that represent really who you really are. So whether this could be your family, your friends, your network of people, your community, or even your own profession, or your own connection with spirituality or connection with land. So 5. Just think of 5 aspects that really define your identity. And stay with that for a few moments, please. Now imagine that for whatever reason, something happens in your life, and you are put in the situation to cut 3 of the 5 characteristics and to voluntarily keep only 2. What would you feel comfortable to keep, and how would you feel when you asked to get rid of the other 3? It's quite difficult, isn't it? It's difficult because it's something that obviously is very much ingrained in our core identity. That, like the picture suggests here, is with a tree, for instance, we do not see the roots, but they are very deep. When they are very deep and they are very strongly connected to the land, our branches can thrive and can obviously bloom. But when the roots are cut, it is something that really impacts even on the ability of the tree to survive. So similarly, this is what happens in the migration event. And as we know, oftentimes that migration event is not voluntary, or voluntarily is forced resettlement. Now, I thought that it is important for us to really understand a set of other terms that we operate with in transcultural mental health space, and that is because we cannot talk about about the culturally responsive practice and a culturally responsive system without really taking into consideration what happens in the migration event and the settlement challenges in the acculturation stages that every single migrant and people coming from refugee and asylum seeking background would experience. And that is purely because we now understand more and more the social determinants of health. So I think it's very self-descriptive. If we look on the right-hand side of this slide, we can see that on the one hand, we have the people who are prepared, that want to migrate, and a totally different experience would be for the people that would have to migrate in order to survive. So obviously, that comes with a lot of need for us to understand what is the context in which the car consumers we're looking for have come to Australia. What happened from a pre-migration history point of view? What are the pull and push factors, as well as what are the key issues that have impacted in terms of challenges around migration? Now, when we migrate, obviously in the first 6 months in the literature, and we all know from our clinical practice in this field, that in the first 6 months, we have what we call the honeymoon period. After this period, obviously, the reality kicks in, the cultural shock is experienced, and with that, significant issues, psychological issues, as well as social and mental health issues could come up. Now, there is a process in which the interaction between two cultures is felt by the migrant and by the people coming from refugee background would feel. And this is the process defined by the process of acculturation. So in this process of acculturation, this is a process that comes with what we call acculturative stress. This is when the culture, the differences between the culture of the migrant versus the culture of the recipient society comes oftentimes in conflict. Now, everyone would experience acculturation differently, and we will see in cult families, we'll see the different stages of acculturation will be felt and will be experienced differently by the family members. Another important thing to say is that during the acculturation process, obviously with the acculturative stress, we also regress emotionally, and this is where we start feeling the need to connect with our family, with our friends, with our community, and oftentimes this is not the results, the protective factor that we used to have back home, and this is further contributes to the mental health issues of the migrant or the refugee that experience this stage. Now, it's very important also to mention here that there are significant issues that are experienced especially by people that are very vulnerable in that category, which is the people from refugee background. Oftentimes, the system is trying to put support in place, but we oftentimes fail in terms of supporting our recently settled migrant and refugee population to support them from a comprehensive point of view. And therefore, it's very, very important to really take into consideration the social determinants, the housing, the accommodation, the unemployment or the underemployment. So these are significant psychosocial factors that come into interplay at this stage. Now, a well-known quadrant that is used in the transcultural mental health field that was first coined by Professor Berry in 2010. In the first and ideal situation, we have the very good sort of the ideal situation of the migrant to live in a multicultural society where the dominant culture is welcoming, as well of not only of the new people, but also they are also flexible in terms of the having different cultures. And this is where the integration happens naturally, and and a quicker pace. In the opposite part of the quadrant, we have the unfortunate situation when the dominant culture rejects welcoming new culture in the society, and the individual level, the refugee or the migrant really does not want to connect with the culture of origin and the community that he belongs to. This is the situation of exclusion and marginalization. And this is oftentimes a red flag when we have the situation of triaging this person at Transcultural Mental Health Center. Now, another important concept that we talked about is the concept of the cultural dimensions that has been introduced by the social Dutch psychologist Hofstede. And although there are 7 in total, I'm going to refer to today only at this one that is most well known, which is the collectivistic versus individualistic aspect. That obviously, these 2 pictures help us to understand how people that are from a collectivistic based society have a different representation when it comes to self, when it comes to justice, when it comes to the support that is expected to have from the community whenever life throws challenges. So it's very, very important for us to really look into how this clash between individualistic based society versus collectivistic based society could play out in the therapeutic and the healthcare interaction. We need to skip on this for the instance, for the sake of time. And I'm going to really highlight here the situation where there is the discrepancy in between the healthcare approach that we have that are not culturally competent versus the health needs, the needs that someone from a collectivistic-based society would have when it comes to treatment and care. So as you can see, so this is a research that was conducted right after the Burundi genocide, the Burundi War in the 90s. And this is where Andrew Solomon talks about how the Western life health practitioners tried in their very good and very goodwill to support with post-traumatic with supporting people with the PTSD. There was a clash in terms of the expectations that consumers had versus what the Western countries had to offer at that point in time. As you can see, being collectivistic, it was so much about having the interaction with the community, and there was no sense of being outside in the sun, and also using the drumming and music in order to have the sense of healing. And obviously using the one-on-one rooms counseling methods that really created the frustration in terms of interaction at that point in time. Now, why culture matters in the clinical context? So first and foremost, we know that culture plays a significant role in the way mental health symptoms are expressed, as well as the way it is conceptualized, it is understood, as well as the way the meaning that is attributed to this. So that gives us a very good idea of the fact that people that will look for treatment having a spiritual explanatory model is going to be very difficult to engage with an approach that relies significantly on the psychotropic medication. It's also very important when it comes to biases in this interaction, because obviously looking from our own cultural lenses, what for us could seem a sign of pathology when it comes to the mental health symptoms and the mental health presentation, can be very much could be culturally normative in our clients' cultural context. Obviously, in 1981, with the introduction by Arthur Kleinman of exploratory models, that really helped us understanding how important it is to have this respectful curiosity and really to enable the culturally safe space for the health providers to interact with their clients. Further to this, psychiatric formulation come up in DSM-4 and then reviewed in DSM-5 with the 4 domains pretty much going into aspects related to cultural identity impacting on the definition of the problem, and then going to understanding the cultural factors impacting on the presentation as well as on the level of functioning, and further to the therapeutic relationship. So some of the barriers that health consumers would have accessing mental health and IoT care, as normal, obviously comes from communications. It is significantly important for us to understand that language plays a significant role in establishing communication and trust, as well as understanding how different health-related beliefs and exploratory models would impact on engagement. So mental health literacy is essential, as well as the understanding of how stigma could impact on our clients' presentation and their barriers to access mental health care. We all know that trauma plays a significant role in terms of the mental health presentations, as well as the impact that it has on trust and building the engagement with the clients. Oftentimes, this is something that we miss, and to really in terms of understanding why health consumers will not engage with the mental health system. As I mentioned a bit earlier, disadvantages on the several social determinants are significantly increased for CAL population. And in addition to that, obviously, they understand having different exploratory models and also having experienced stigma constitute a significant barrier in terms of navigating the mental health system. And for that, that is why it's important for us to really understand that a significant role that we play is to support our clients in understanding how to navigate the system, as well as how to advocate for our consumers. Now, back in 2017, when Transcultural Mental Health Center was conducting extensive consultations in understanding the disparities at the system level, we identified that through the corroboration of the information from different sources, that CAL consumers' access to public mental health system is lower when compared to the people born in English-speaking background. If you're a CAL consumer, you are more likely to be diagnosed with a psychotic illness, or treated involuntarily, being secluded, or being treated on a forensic order. It's also more common for CAL consumers to be referred by an emergency department, as well as have a longer average length of stay in an inpatient ward, or to be less likely to be followed up in the community within the 7 days of a referral. Now, with that in mind, obviously, very easy is for us to start looking for someone to blame. And without us adopting an approach, a system thinking approach, would be pretty much impossible to address these issues. As a result of that, at Transcultural Mental Health Center, over the years, we developed a service model that looks comprehensively from obviously, as you can see on the right-hand side, is about supporting the mental health workforce to become culturally competent, obviously to support with engagement, to support with accurately diagnosing clients, and to really have a better mental health outcomes, as well as very important to really look into what is happening in the CAL community, why people do not access mental health service earlier. And one of the hypotheses is obviously around understanding the significant importance that stigma plays into this situation, as well as increasing the health literacy and understanding and normalizing experiences from early stages. Now, it's also very important to say that all this expertise that we have been built over the years really has a very strong clinical foundation here in terms of triaging and assessing CAL consumers that, due to their complex presentation, where trauma and culture interfere with the mental health issues that they experience. It would significantly impact access to the mental health system. So, like I said, it's very important for us to, before we look into how we can influence the system to achieve the culturally responsive mental health system, it's very important to adopt this systems thinking approach and to really understand what the gaps are. And as they say, playing the game is changing the rules. We are a part of the system, so obviously it's very important to really understand the significant role that we play in this bigger picture of the system. Why a transcultural mental health practice framework? So first and foremost, there is no specific practice framework that provides a consistent and comprehensive guide for evidence-informed mental health practice with CAL consumers. And without this, this consistency and this guide, is very hard to influence the mental practice in a consistent and coherent way. So identifying what the best practice looks like when working with CAL consumers was the first important step that we undertook when we started this project. Evidence suggests that mental health service, which is more culturally responsive and inclusive, will achieve improved patients' outcome in delivering mental health care to CAL consumers. And I put here an important article from the UK transcultural psychiatrist, Dr. Bui, to really underline how people in this area from all over the world pretty much concur with these ideas and these conclusions. Now, what is very important to see that the impact that having a transcultural mental health practice framework could have, first of all, would have an impact on improved outcomes for consumers, and all the literature talks about the importance of having a trauma-informed, culturally safe and responsive service, and how this should look like. You can see here one of the authors in the field, as well as if you're looking from a trauma-informed point of view, obviously the more the better engagement and the more trust we have with our consumers, the better mental health outcomes will have. Now, that is to say also that in this model, it goes beyond the biomedical model and really look into significant importance that psychosocial needs and the holistic needs of our consumers would play in this stage. Now, at the second level, improved outcomes for the workforce. We know that there is a significant issue around confidence, and it's understandable, given the fact that obviously in the tertiary education, we haven't been exposed to what cultural competence really looks like in practice. So once we have this increased confidence of our workforce, we strengthen this through various layers, from the professional development of the professional, through supervision, to training, and also to supporting their own team leaders in order to further create mechanisms of support for the workforce. Obviously, with greater work and role satisfaction, we come also with better consumer outcomes. And last but not the least, is very important to really look, like I said at the beginning, into enhancing the workforce readiness to respond to this increasing cultural diversity in the population. At the system level and the organizational level, it is expected for this to create an improved quality of care. And there is an important article that came in 2015 in Lancet that says the systematic neglect of culture in healthcare is the single biggest barrier to advancing of highest attainable standard of health worldwide. So just reflect on this for a while. So if what that impact, what impact this could have at not only in our mental health system, but thinking about that if we get it right for a cult consumer, we get it right for anyone else. So pretty much in by and large, it is about being client-centered and really be reflective and holistic and in the approach that we consider for healthcare. So obviously that comes with expected reduced healthcare disparities and a reduced set of service delivery gaps, and obviously would impact on the quality and safety. And because everyone talks about how costly that would be for us, imagine to invest so much in developing cultural competence system. So the international literature talks about the fact that at the beginning, investing in cultural competence is going to have higher costs. However, in the long run, the investment is going to have a very good return. The purpose is to develop this set of guidelines that identify not only the knowledge, the skills, and the behaviors, but also to identify the values and the attitudes. So it's so much around that underneath side of the iceberg when it comes to the values and the attitudes that we have, and also to really embed in our practice the cultural humility and curiosity when it comes to our willingness to develop in this area. The target audience is mainly the multidisciplinary public workforce from the entry level, like I said, to advanced, and is as our services across the spectrum of care, clinical setting, age ranges, and across the state. This obviously is going to be aligned with the existing mental health workforce policies and accreditation, and will draw upon the existing frameworks and the key documents that currently exist and guide our practice, but also our future when it comes to the strategy. Obviously, we are all aware of the recent parliamentary inquiry and with the recommendations that were made around cult consumers. And I thought that in the next few minutes, I'm going to really talk about how we started developing this framework, allowing up to 5 minutes at the end to have some questions and comments. So we started by reviewing the existing literature and conducting initial scoping, and then we identified the relevant stakeholders, the end users, and the experts in the field. We further went to develop projects plan and methodology for evaluation. So obviously we look into having a solid research foundation. We establish an advisory group and a wide range of consultation groups. We started drafting, having the first draft of the framework through consultation and incorporating the content. We're going to have later on this year the pilot of the draft. We are going to incorporate the outcomes that will come from this pilot stage, and we're going to look into the implementation stage at the end of the year. As I said, the wide range of research methods. Obviously, for such a project, we need to really consult widely, but also we need to be realistic in terms of what's the best way to engage and consult with people. Keeping with this system thinking approach, it's very important to really understand that we can't do this on our own, because it's about really having, like the name suggests, bringing it all together. It's very important to be relevant for our work across the state as well as across the spectrum. Now, in the advisory group, we have had and we still have involved representatives from various leadership areas across the HSSs and across the disciplines. Obviously, we do have peer work representative. In the consultation groups, we are at the stage where we engage with CALD consumers and CALD communities. This is obviously very important, is very relevant to the work we do, and to be informed by those that we are here for. And having said that, obviously we spend significant amount of time in really engaging with bicultural workers and community elders to really consult on what's the best way, what's a culturally safe way for us to engage with our communities and our consumers and carers. We will be consulting, and we started consultations with NGOs in the multicultural sector, with the PHN, obviously, as well as I mentioned a bit earlier, it's very important for us to look into the impact that this is going to have in the tertiary education sector. QCM and Insight have been also a part of our groups. This is the level of impact and the influence that it has through various channels. This is the project timeline, and as you can see, we started with initial scoping. The impact the COVID impacted on us, and obviously the readiness of our workforce, as well as our own ability to prioritize and reprioritize, given the shortage of staff we have had. And this is so we are very much having consultations and continuing, like I said, in the communities, and then we focus on data analysis and pilot testing. A little bit of the what. This is the outline that has been explored with various stakeholders, and also has been endorsed by the branch and by the advisory group. So we cannot talk about obviously transcultural mental practice without really looking into the main pillars, the main principles of care that underpin transcultural mental health practice. And here, having health equity and systems theory, as well as the self-care and self-reflected practice, one of the main important priorities. We cannot talk about transcultural without having the context, so we really need to understand and to really shift the paradigm, looking into rather than the symptoms, to understand, like I said, the story of the clients that we deal with. So and part of that story is about the pre-migration history, the impact of settlement. Like I said that previously, the acculturation process has into the life of our consumers. Obviously, engagement is an important aspect, and hence a significant attention that is going to be given is about strategies around engagement and the impact that trauma could have on our consumers. I'm going to go quickly around some of the elements around building transcultural mental practice capability, and obviously how this translated various levels from the individual to service level, and then to the system level. Now, before we finish and have the 5 minutes for discussion, I think I would like to also take this opportunity to really really provide some information about the work we do at the Transcultural Mental Health Center, and how we can support the services that are within the public mental health sector, as well as outside in the community and NGO and PHNs. So if you're not sure, just give us a call or contact your multicultural mental health coordinator, local, and as you can see, we have a wide range of mechanisms that we developed over the years, from primary to secondary and tertiary consultation, to really look into, even if we don't have consent, how to support you in providing the most culturally competent care from your end. These are our contact details. And now I'm going to up on to questions, comments, and suggestions, please. Thank you.
Thank you very much, Dragos. That was a great presentation, some great use of imagery all the way through the presentation to just kind of make those points come forward. I've got some questions here that have been that we've received throughout the presentation. So one of the first ones was, I am curious whether the literature views culture associated with ethnicity as substantially different in impact to that associated with other aspects of identity, for example, sexuality, or whether these are viewed as similar.
I think that's a very pertinent question, very contemporary. It's when we tended to look in the past at culture, pretty much coming from more from the ethnicity, from religion, from the national aspect, as well as from the belief system and the values, and belonging to a certain ethnic group. As I said a bit earlier, I think in today's society, when you look into diversity, and if we keep the same principles of practice that I mentioned before, we cannot go wrong when it comes to meeting the needs of people that are different than the mainstream, and obviously sharing these values around. Ultimately, we are all human beings on this planet, and this is very, very important to find the best and most respectful way to engage in treatment, and coming from the narrative of the individual.
Lovely, thank you. Another question was, is there any more you can tell us about cultures that are not associated with geographical location?
So obviously, culture can be created in, let's say, in our own space, in our own community. Obviously, we have, for instance, the New Age culture. You know, where I live very close to Mullumbimby, to Byron Bay, and there are cultures and there are groups where people share their views, their values, and we oftentimes have and belief systems, and oftentimes we have referral to transcultural mental health that that are sent to us, and they ask us, you know, this is not necessarily about a certain nationality or a certain geographic space or a certain migration experience, but can you give us some tips around how to work in a culturally responsive manner with this particular client that comes from this particular group? And obviously the question, the answer is similar. It's very important to look into what is considered as normative within that specific cultural group. And once again, when we're talking about spirituality, for instance, there are people that present with different meanings and different ways of looking into a belief system, and belief system really kicks in when it comes to dealing with a mental health issue. Hence, we have various ways of presenting, and oftentimes presentations to the public mental health services would put the health practitioners in difficulty around how do I assess this person. And like I said, the important question is to assess that person within his own or her own cultural context, and we cannot go wrong with that.
Thank you for that. And then there's 3 more questions, but they're very similar in what they were asking, in that one is that how can CALD mental health practitioners and community leaders be a part of the transcultural framework? Would you be interested in working with other institutions who are doing research in this space? And can people contact you for more information?
100%. Please do use the contact details that we're going to provide in a PDF document. And 100% we are more than, it's not only that we are more than happy, but we are thankful, we're grateful and very interested to have you on board in this consultation process. Thank you. Appreciate that.
Lovely, thank you. So Dragos has kindly said that he will come back and present in early 2024 to provide us with some information on the pilot and give us an update on where things are at. So there will be a part 2 to this presentation early in 2024. Dragos, thank you ever so much. There's a lot of thank yous that have come through on the chat for this presentation today. And for everybody else, this is our last one for semester 1. Our semester calendar will commence again in August 2023, and keep an eye on the Insight Scoop that will tell you when the calendar is out and the date of the first presentation. So Dragos, again, thank you. If you could fill the survey on your way out, and we will see you all again in August.
Thank you very much once again for the opportunity. Thank you for the interest in this field. Have a good day.
Our pleasure. Thank you.